Hi, I'm Dr. Avi Mendelson, and today we're going to talk about transoral robotic surgery. We want almost all patients with HPV positive cancers to at least have the evaluation, to undergo an evaluation to see if robotic surgery is appropriate for them. We're seeing patients with even advanced tumors potentially benefiting from surgery, but certainly early stage HPV, tonsil and tongue cancer, these are the patients that really need to be seen for potential robotic surgery. So what the robotic system can do is it gets my eyes up close and personally into the throat. It gets our hands miniatured. So what I can do, precise computer guided surgery. There's no tremor, everything's advanced, everything's miniaturized. Our ability to preserve normal tissue is more than we ever had with traditional surgery. The blood loss is essentially minimal for almost all of our throat cancer surgeries. We're seeing less scarring. Again, ultimately, the patients are benefiting. High function, high recovery. It's really exciting. So when you think about what was traditionally done for throat cancer surgery, very morbid open approaches, which required breathing tubes, meaning tracheostomy, feeding tubes, 2-week stays in the ICU. It was brutal. What we're doing now, what we're seeing with transoral robotic surgery, and really any surgery that's done through the mouth, we don't need to put in the breathing tubes after the surgery. We don't need to have feeding tubes. And so we're seeing immediate improvement in terms of the function, and then certainly long term, they're quicker to get back on their feet, quicker back to their lives. Very cool stuff. The most common question that we're getting is, what are you going to be doing during the surgery? Who's doing the surgery? And it's important to know, I do the surgery. Robot doesn't do anything. The robot is essentially my tool. Just like any other tool in surgery, the robot is my tool. I'm a few feet away from the patient, so I'm not technically touching the patient during the surgery, but I'm right there in the operating room, and every movement is my hand motions, or actually my foot pedals, because there's a lot going on in the controls of the robotic surgery. So we're doing several surgeries all at once during the same anesthesia for transoral robotic surgery. We're going to first start in doing an endoscopy. We want to make sure that the tumor still is something we can achieve a successful or clean surgery from. We'll move on to do the robotic surgery. The robotic surgery to remove the tongue or tonsil tumor takes about 45 to 60 minutes. We'll send off margins to the pathologist. That takes a few minutes as well, probably about another 45 to 60 minutes. And we also need to do a traditional lymph node surgery to remove the lymph nodes on that side of the neck. All of those things together usually take about 3 to 4 hours under anesthesia. By far, the biggest thing we're fighting with after the surgery is comfort. The throat pain is significant, and so we have multiple ways to treat it. We treat it in a multi-modality, meaning lots of different strategies to try to get the pain control. The intensity of the post-surgical pain is approximately 14 to 16 days. It's important that patients really kind of gear up for about 2 weeks, sometimes a little bit longer, of that intense pain. But really what most of my patients will report to me is like overnight, they feel better. Like somewhere around that 16th day, they feel like 80-90% better. It's really amazing. Just wake up and like, oh, I'm back to myself again. They'll still notice something for about a month in terms of some nagging discomfort, but the intensity, 2 weeks and we're done. Most patients think that when they're having a major surgery like transoral robotic surgery, they're sleeping, it's not a problem, I'm just taking a nap. But in fact, the body sees it as big a stress as running a marathon. So you gotta train, you gotta get your body stronger, you gotta build up and bulk up, eating, gaining weight, because there'll be some weight loss after the surgery. And so some patients will say, oh, I want to starve the cancer out, which is not scientifically based. Do not starve cancer out. Cancer is the ultimate parasite. It will take your energy. So there's not enough fasting you can do to starve out a cancer. You want to build yourself up strong enough so you can be okay throughout that post-operative period. So Da Vinci transoral robotic surgery is done for a diagnosis of throat cancer. We absolutely make sure that no matter what the healthcare coverage, that we get authorization and it will be covered by insurance. Every plan is different, so some patients require some participation depending on their policy, but absolutely this is something that needs to be covered by insurance.